This is Health Call Online, the place for extended versions of interviews you hear on our weekly radio broadcast, the Health Call Radio Hour, now being heard in more cities around the country through national syndication. We talk often about some things you have to monitor and watch to stay healthy, and I can't imagine a more important set of numbers than your blood pressure. No, wait, there is a more important set of numbers, and that might be your blood sugar level and your glucose level. Understanding the combination of factors that go into high blood sugar is really important. And long before you see your doctor for a prescription to help with that, your pharmacist can be a real assist in helping you maintain blood sugar levels. So that's where we're going to focus today, a pharmacist's guide to blood sugar control. And of course, who would I reach out to other than Greg Russell, the founder of Fort Wayne Custom RX? He is not only a pharmacist, he is a clinical nutritionist. Greg, thanks for being here. Did I overstate that? Is there anything more important than blood sugar today?
Well, it certainly is one of the top two or three items that are really important because it's a tie-in to everything else that goes into your health. It's
Yeah,
certainly
if your blood sugar is out of control, that contributes to high blood pressure and so many other factors. So
that's right. Unfortunately, uncontrolled blood sugar is a leading cause of death in cardiovascular disease, or one of the leading causes of death, and it all ties into weight control and diet, and so we'll touch on all those today.
yeah, we sure will. Let's start first with kind of a brief explanation of what are the numbers that I really need to pay attention to. Is it just my fasting blood sugar level, or do I need to look more at the A1C?
Yeah, well, I'm going to throw another one in there called insulin levels too. So
Hmm, hmm.
let's explain a little bit about what normally happens during digestion. So during digestion, what happens is we start breaking our food apart, and it's in the stomach, and then somehow through that digestive process, we got to get it into all of our cells. And one of those ingredients is called glucose, and glucose is the most simple form of sugar. We need it to survive. The cell, the brain definitely needs glucose, and so does all of our other vital tissues. And when we get low on glucose, called low blood sugar or hypoglycemia, then they start acting kind of goofy because they can't think. Okay, because the brain is the first organ that's really important to save for that. But basically what happens is there's in the pancreas, there's little cells called islets of Langerhans, and they secrete a hormone called insulin. And insulin's job is to be kind of the key that opens the door to the cell. So when you eat your food, glucose levels go up normally. Then insulin is secreted by the pancreas. As insulin is secreted, it opens up the cells, and the blood glucose goes from the bloodstream into the cell. And that's the
Mhm.
way normal physiology is supposed to work. And that's great as long as we can control those levels of all those hormones. So, back to your question of what do those numbers mean? A fasting blood glucose was primarily the way we diagnosed. And so you would have overt diabetes if your blood glucose was greater than or equal to 126 milligrams per deciliter. And that's a fasting blood glucose. In other words, you don't eat at night. The next morning you get up, you take your blood sugar before you eat any food. So you're
Right.
getting an empty stomach, a low blood glucose, what should be low for the day. And doctors would make that diagnosis. There's different ways they can do it, but to make that diagnosis, they have to have two blood glucose measurements that are above equal 126. Now, there's also a number that I'm even more concerned about called pre-diabetes numbers.
Hmm.
And those numbers are when we start seeing blood glucoses over the 100 milligram per deciliter. Because the neat thing about treating diabetes is we get some early warning signs along the way. We have time to react for most patients, and that's for type 2 diabetes. And so when we look at an A1C, we're looking at a blood glucose level that has been high enough that it's actually damaged some of the red blood cells. And so they'll take the measurement off those red blood cells. It's called hemoglobin A1C. And typically, if we get into that 5 range, and when we get above 5.7, that's when you're going to be diagnosed with diabetes.
Got it. And then you also mentioned the insulin level. Is there, how do I test for that? How do I know what's going on there?
Yeah. So again, insulin levels are really important too, because insulin starts to be elevated long before blood glucose does. So over time, if you're constantly having high blood sugars, then what's going to happen is your insulin levels are going to start to continually rise, and they won't go down like they should. And so you can get a blood test where you look at your insulin. And typically, when we start seeing insulin levels around 11 or whatever, we're starting to get a little more concerned that there might be some resistance going on. Because it's kind of like driving your car down the highway. If you're driving fast all the time in a lower gear, you're going to burn out your gears. And that's
Right.
kind of what the body reacts to insulin, because over a period of time, the body quits listening to insulin, and then it cannot move that blood glucose into those cells. So it stays in the bloodstream, and then that's what creates a lot of those health issues.
Greg, one of the things that I love talking with you about is you take these complex subjects and make them easy to understand. So good
I
job
try.
explaining all of that. Yeah.
That's the
Nice
only way I
job.
can remember them too.
So now let's focus on long before I'm seeing the doctor and diagnosed with diabetes. You said my blood sugar can be starting to climb, the insulin levels is starting to climb, but there are things I can do about that. Diet and exercise we know are important. We'll kind of just leave those on the table because I think that everybody understands we need
Hmm.
to eat a better diet and move more. But beyond that, there are some things that we can do to help our bodies get through this challenge. And the first one does go back to a food product, and that is fiber. Tell me what makes fiber in my diet so important for blood sugar.
Well, fiber is very important because one of the things that causes insulin to rise quickly is the release of glucose very quickly into the bloodstream. So if we can slow that down, which is, by the way, some of the diabetes medications that we use to treat diabetes work
Mhm.
that way too. They slow that digestion process down. If we can blunt that peak, make it slower, then insulin has time to react and it doesn't go up as quickly. And the thing with insulin is when insulin's going up very rapidly, it's very inflammatory. So it causes damage too. And so
Mhm.
does that high blood sugar. That I always tell people it's like little glass floating around in your bloodstream or sand in your
Mm,
bloodstream. It's going to start affecting the lining of your vessels. And that's why we see so many different organ problems.
yeah. Yeah, that's those lining of the blood vessels, those are called the epithelial cells,
Hmm.
and it's just one layer thick, right? And so
That's
any
right.
kind of little damage gets there. It can really aggravate and cause essentially a clot to form. Your body tries to heal that by creating a blood clot, which can then lead to all kinds of problems.
Right. The immune system gets out of whack, and it becomes a kind of a cycle thing. And so what we're trying to do is reduce that from happening in the first place. Get ahead of it, because it usually doesn't
Yes.
happen overnight.
So fiber is important, and
Hmm.
I don't have to take a supplement. It's just adding a few things. There are some foods that contain a tremendous amount of fiber, and you might not know it. One of them that I use a lot is avocado. A tremendous amount of fiber in avocados.
Avocado, things like raspberries. And,
Hmm.
so when I tell people, I try to keep things simple, plant food, try to get, some plant food through your diet every day, because that's important. Because really, when it comes to diabetes, we're trying to get 25 to 35 grams of fiber a day. And by the way, I do have a handout that we have readily available that people can get from us. That is really important because it explains, if I could just have a vegetable with each meal, you could get to that 35 grams, because that is going to
Right.
slow down that impact. That's huge.
Yeah, it's hard to say anything more than just add more fiber to your diet.
Right.
So
And water
beyond
with that.
Well, of course, right.
Yeah.
Now let's talk about some of the other components, some of the other elements there.
Hmm.
And this is where we step into the nutritional supplement world.
Right.
And I know you feel very strongly about the role of magnesium for people who are pre-diabetic and diabetic. Why is that?
Well, magnesium is involved in a lot of different what we call metabolic reactions or enzymatic reactions. Magnesium drives a lot of these chemical reactions. If we didn't have enzymes in our body or things to help drive our reactions, we wouldn't have any chemistry going on. So
Mhm.
What we know is that patients that have high blood sugars tend to use up a large amount of magnesium each day. And that goes for things that cause us to lose magnesium. So, athletes that run a lot or sweat a lot, they're taking magnesium
Mhm.
out of their body too. So, we need to try to replace that. And generally, one of the signs that we'll see, and we do see this a lot with even our patients with diabetes, is they have problems with getting cramps, in their calves or in their toes or in their fingers. And so part of that is magnesium being utilized. So we like to we start with magnesium and fiber. Those are real easy to do. And again, you can get magnesium through a lot of plant food, but it's an easy supplement to take too.
Yeah, and it also helps improve the quality of sleep, is what I've read
Absolutely.
from
It
some
helps relax
previous
those
research.
muscles. Hmm.
Yeah, that's very important. So magnesium, something to think about. Here's another one that I think people may not have heard about: chromium. Now, we're not talking about the stuff that makes your bumper shiny on the car, right?
No, we're talking about a trace mineral chromium. And chromium, it definitely has been correlated to helping that insulin receptor become more sensitized to glucose and insulin. And so it plays a role. And again, a lot of what we like is we like combination products that have multiple ingredients in them, so people aren't
Hmm.
taking a bunch of different products,
Right.
right?
Yeah, that
But
makes a lot of
chromium plays
sense.
a real important role in that.
Uh, this one was a little surprised when I saw it on your list. Cinnamon. Now,
Cinnamon.
I've read that cinnamon plays a role, but help me understand why and just how important that is.
Yeah, cinnamon is kind of, I think it's fallen a little bit more out of favor over the years. I think it plays a role, but maybe not as dramatic of a role. To take the actual herb cinnamon, we're not talking about the stuff that you sprinkle on toast,
Yeah,
that's kind of been
yeah.
sweetened. That's a hard herb to take if you're taking it in the raw form. But a little bit probably does help. Again, it appears to help with that insulin receptor and kind of help with the sensitizing on that.
Next on the list of supplements that you can consider nutritional supplements is alpha lipoic acid. Now, we've
Yeah.
talked about this before, but let's give it a focus as it applies to blood sugar control.
Yeah. Alpha lipoic acid is often called the universal antioxidant, which means it's used in almost all our cells. It helps quell out the fire. One of the problems we have when a patient has diabetes, their blood sugars are high, they're running, we measure on that A1C advanced glycation products. In other words, that sugar has kind of been burnt a little bit on your red blood cell. And so there's oxidative damage going on. And so
Mhm.
alpha lipoic acid helps reduce that. It helps with some, again, that insulin resistance. It helps control some blood glucose levels, but it also, I think, one of the problems we see with patients that have a lot of blood sugar, chronically high blood sugars, we start to see damage in the cells, and I think that's where alpha lipoic acid's role is: help prevent some of that damage. They get
One of
that
the
numbness and
problems
burning.
Yeah, I was just gonna go there. One of the big problems for diabetics is peripheral neuropathy,
Right.
that tingling and burning in the feet predominantly, also sometimes the
Right. So we're
hands.
trying to
And so
catch this early on, right?
right.
So it doesn't become a
And
problem.
then, what foods can I eat if I don't wanna take a supplement? How much food would of these foods would I need to eat if I
Yeah.
don't take a supplement?
Well, I'll be honest with you. I've never seen a food that has heavy enough alpha lipoic acid in it. So, again, you get into your plant foods. Green foods have chlorophyll. Chlorophyll, part of that is magnesium holding that chlorophyll together. And so you're going to get your magnesium again in your plant food. Things like, um, to try and think of the seeds, pumpkin seeds are really heavy in magnesium. So there are
Mm.
foods that are heavy in certain minerals.
But if my diet has been out of sync enough that now I've got myself into a blood sugar problem, I'm not getting the right nutrients anyway, so
That's
supplements
right.
are the end. Yeah,
Kind of thinking of, you're kind of front loading here because you've been in a state of deficiency by not eating a
mhm,
good diet. And,
right.
you kind of have to think about what you've been eating. And when it comes to diet and meal planning, we just start thinking the basic stuff. What little things can I do that add up that help me throughout my week?
And here's a supplement that I've don't know a lot about. Is it Gymnema?
Gymnema. Okay. So Gymnema is a real interesting product in that Gymnema. has has actions actually on the pancreas beta cells themselves to help secrete insulin. So gymnema is a herb that comes from the Middle East and has been shown to help lower blood sugars. And so
Mhm.
again, when you start looking at combination products, that's what I like because I think you get more bang for your buck. And it doesn't have to cost you an arm and a leg. If you can get some product that has a bunch of different multiple products in it. So that's why we recommend the product we recommend because we like not having to have people take 12 different medication, 12 different
Right.
supplements.
Yeah. And before we talk about what that product is, I want to hit just one more that people may
Sure.
not have heard of, and that is berberine.
Berberine, one of my favorite
Yeah.
products. And I like berberine and alpha lipoic acid together. And one of the reasons is berberine kind of acts, it's kind of the herbal. It's not exactly, and I can't, say it's FDA approved because it's not, but it kind of works like metformin. So it has kind of
Hmm.
similar activities. It does help. It works on AMPK, which is our energy producing pathways in our body. It helps your body burn fuel more efficiently. So, and berberine has some other nice benefits. One of the things it is it kind of helps restore your bacterial or microbial balance in the gut. By
Mhm.
helping the good bacteria thrive. Other things that it does, it helps lower lipids. It does help have some effect. Again, I can't tell you that it's FDA approved for those things, but it seems to help support that product. And so I love berberine. I take it myself, and I think it's a very good herb.
So the combination product, so I don't have to go through and take, 15 different capsules every day.
Right.
How are these things blended together? What do I look for?
Yeah. So, one of the problems I've seen on things that have been marketed on the internet is I hate products that say proprietary blend because I don't know how much of anything is in there. It's just, they're just throwing a bunch of stuff in there, but they don't tell you how much. And I understand why they do that. That's to keep their little trade secrets. But on the flip side of it, when you look at the studies, you have to know how much of a certain ingredient was used in a study. And when you're
Mhm.
using 1/100th of the strength of a product that was actually done in a study that showed it had a benefit, then you're not buying a good product. And so
Right.
again, I think going to a reputable pharmacy that has experience, and I'll always plug compounding pharmacists. Many of us are independent, but many of us have learned a lot about what good herbs are what go ask for a professional. And so we try
Mhm.
to bring in products that work because if they don't work, they're not coming back. So this is that simple. Yeah.
Yeah. So the product that I know you like a lot is one called cardiovascular health, metacardiovascular health, and this is something that's private labeled for you.
Mhm.
Let's talk about what's in it and then how I can find that.
Yeah. So again, and one of my favorite products, it contains two of my favorite ingredients, berberine and alpha lipoic acid, which we talked about in combination. And that might be a product that I have somebody who just says, hey, my cholesterol's starting to rise, my blood sugar is starting to rise. It's fairly easy to take. It's 2 to 3 capsules a day. And and the good thing is you take it for 3 to 6 months and you recheck your levels and see if you're making an impact. And then you need to look honestly at things like, is my diet, did I increase the fiber in my diet? Did I start
Mhm.
doing some exercise? Because we know exercise also helps move the blood glucose into the cells. So,
Sure.
these are all part of the same program. But I like that product for maybe patients that need just a little bit of help, but aren't quite, you know, they're on their way, but they're not there yet.
Gotcha. And then you also have a product called Diabetes Balance. What's in this, and who is it really for?
Yeah, so this product I think is a little more aggressive, and I have used both together. So for patients that really need a little bit of help, but this product has a lot of these different ingredients already mixed in. It's going to have the vitamins that help. It has some magnesium in it. It has a little bit of. It has a blend. It has the alpha lipoic acid. It has gymnema, bitter melon, and another one called Langerstromia, which I can never pronounce.
Hmm.
But these products actually have some science behind them to actually lower blood sugar or blood glucose levels. So I like them because, again, it's one tablet or 2 capsules a day, and it's easy. pretty easy to use.
So, are these products geared toward people who are in that metabolic syndrome stage, that pre-diabetes stage, or is this more if I've already have been diagnosed and taking meds?
Yeah, I that's a great question, Lee, and blood glucose is something to be taken seriously. So people are, if they're into that range where they have diabetes, they need to make the changes. And I would probably say you can use some support. For example, there's a study that shows that vitamin D 2,000 IU's per day helped lower lower blood glucose levels. Well, that's a support item. You still need to take the medication, or you still need to do all the other things to support that. But I would not use these to treat a patient that has type 2 diabetes that has been diagnosed with diabetes. I would use these to support. And I think that you're going to get best support when you start looking and say, hey, my blood glucose is 105, 110. I need to make some changes now, because there was a study done back years ago by Kaiser Permanente that showed that blood glucose for every 1 point over 85. So remember, we said 100 was the cutoff, but for every
Mhm.
1 point over 85, you have a 6% increase chance of developing diabetes. So by the time
Wow.
you're at 95, you already increased your odds by what, 60%.
Yeah.
So,
Wow.
it's probably the cutoff really is lower than 100. If I'd be looking at my blood sugars, if I'm at 95, I'd be starting to think, hey, I need to at least pay attention to this.
So if I want to consider these products, I can find them online at fwcustomrx.com. Can you ship all over the country, or are there limitations there?
Yeah, we can ship supplements anywhere. Prescription items are, of course, different,
Right.
and
Okay.
we have to be licensed in those states for prescription items.
Okay, great. But as you said, always go talk to your compounding pharmacist and just put an extra few words on that. What is the training that makes you a clinical nutritionist in addition to a pharmacist?
Well, I, did some extra coursework, of course, and I've just been fascinated my whole life with herbs and supplements. And I think pharmacists are in a key position. And unfortunately, there's a void today. And unfortunately, I feel like the internet is trying to fill that void, not necessarily with people that are always reputable. And I think most
Mhm.
pharmacists that are, they're a pillar of their community. They have an intent to try to help their patients, and they're going to be able to tell you, they're going to be able to at least point you in the right direction and give you help. And I think we're a key middleman. I think it's our job to kind of help support the doctor's plan for the patient. And it's not
Mhm.
that we're going to override the doctor, because we don't. And I would look for pharmacy that's ACHC certifying and compounding, or at least a nice, strong, independent pharmacy that has knowledgeable people about supplements. So,
Great. I think I hope we help some folks here today, Greg. Good things to think about if you're on the path toward diabetes or struggling to keep that or blood glucose under control. See, you slipped there. I almost said blood pressure, but they're so important. They
they're
kind of go
both they're
together.
both important. And we've talked so often about metabolic syndrome, and this is just one leg of that. And so, I always tell people the five things you want to, make sure keep your cholesterol, your blood pressure, your blood sugars. Those things are all so important all together to, the waist around, your weight, your circumference of your waist. All those things really will tell you warning signs, and they're not hard to measure.
Mhm.
You just need to stay on it.
Yeah, good advice. That's Greg Russell. He is pharmacist and clinical nutritionist, the founder of Fort Wayne Custom RX. You'll find him online at fwcustomrx.com. Greg, thanks.
Thank you, Lee.